Hi, everybody. Welcome to the waiting room. I'm Demi Montgomery, and I have Rod Douglas here with me, and also Jim Sliney from Patients Rising. He's our guest today. We just wanted to come on and say hi, but before we get started, we want to talk about that we are not medical professionals. Everything talked about and discussed in these recordings are just for entertainment purposes only, and just to provide information and resources to the patient community. We are not medical professionals. If you do need assistance, please refer to your local physician. So I'll turn it over to you, Rod.
All right. Well, Jim, it's been a while since I've seen you. It's good to see you again, my friend. And we're very excited to have you with us. I just wanted to start off with this, I guess, just to give you a chance to talk about your mission and tell us what you're all about there.
Oh, sure. Thanks for having me here. I really appreciate it. Any opportunity to talk about the good work we're doing is a great opportunity, in my opinion. So Patients Rising has existed for since 2015. And its mission is to really elevate the voice of patients in healthcare discussions across the board. A lot of our focus is on getting patients access to affordable and dignified care. And as we try to define what that means, we realize that the definition is extremely broad. Transportation can be an obstacle to access, language, discrimination, different diagnoses, geographical locations. Anything really can be an obstacle for patients to get access to good care. So the longer we do this, the more we realize how much wider and wider this mission is becoming. But we're ready to tackle it because, well, nothing's really more important. Once people can have access to care that they can rely on, we feel that people will be better overall. Our healthcare system is a little messy. Maybe that's an understatement, but we can find our way through it with good maps and good guides. And so that's what drives the programmatic development at Patients Rising. And I'm happy to say that as of January 1st, I've transitioned to the executive director of Patients Rising from my role as director of patient outreach. So my job is to keep all these programs and missions on point and keep the flow of conversation going with patients, caregivers, all the stakeholders that our mission impacts.
That's amazing. You're giving an avenue for voice for all of us to have a voice. You also mentioned a little bit about, it's kind of like you have a little bit of an education piece as well. Can you speak on that a little bit too?
Sure, yeah. Since the very beginning, part of our mission has been to support patients. You know, when you hear the term support patients, it's not always clear what that really means. What we feel that it means is being able to provide any individual with the building blocks for self-empowerment. And that involves, if nothing else, communication skills, but it also involves understanding how laws work, because our access to care is affected by the laws in the areas in which we live. So we built a legislative advocacy masterclass with the help of Lily Stairs of Patient Authentic. And we've completed 5 semesters of the masterclass so far. We just graduated our 200th student, the goal of which is to get people to a functional level of understanding of legislative advocacy. That is, going to the Hill, talking to your legislators, meeting with congressional representatives, but also understanding how the FDA works, what a drug utilization review board is, and how to take advantage of the mechanisms that already exist to move your own personal patient or caregiver agenda forward. Because every patient that succeeds helps all of us succeed. So we offer these learning opportunities to anyone. There is really no restrictions here. And in 2023, we're also offering a new curriculum, which are 7 different courses on self-advocacy, which include things like communication tips when talking with your doctor, how to manage your electronic medical records, what are your rights as a disabled person in K through 12 or institutes of higher learning or on your job. The kinds of practical knowledge that we think people need to succeed. We think this because we ask people and you all tell us what you want to learn more about. And that's what drives what we build. So we have a lot of educational opportunities in our Patients Rising Learning platform, which are going to expand quite a bit this year. I'm really excited about it.
That's really awesome. So I like that you have the, you're training on how to do some self-advocacy. I know that's going to help some caregivers as well. I know you've alluded that they're also involved with this training as well too, right?
Yeah, that's right. You know, it's unfortunate that there isn't really a good word. We use the word stakeholders as sort of a catch-all for people who are interacting with healthcare. It's not great. But when we're talking about elevating patients' access and empowerment, we're really talking about patients and caregivers. And of course, the families that are impacted by the chronic diseases or rare diseases that people live with. So if you're in a household where you're the healthy person, but your parents have chronic illness or your children have chronic illness, a family experiences a diagnosis together. So we don't want to turn anybody away. So we try to build our learning opportunities for everyone, caregivers, patients, allies, whomever. We build them for people who have some experience with advocacy, try to level them up a little bit. But it's also very open to people who have never raised their voice before and have decided that it's time to do that. So yes, caregivers, patients, families, allies, all are welcome.
Yeah, and that's the biggest challenge, being a caregiver myself, of course, first with my sister and now with my father who's in hospice right now. I struggled with finding information too. So having an organization like you, knowing that you exist, and also what Demi and I and Amy and Dee are doing with the waiting room, having in a sense, a resource for people to come to, it really means a lot to me personally, because, I mean, talk about a scramble. You don't even know where to start, you know, so having these conversations and having a gym to come to and say, look, this is what I'm faced with. I have zero idea where to even start. This is fantastic. And like you said, with this training for self-advocacy, not only for the patient, but also for the caregiver, a lot of times, like our friend right now, Amy, she's not feeling well right now, but she has us and she has family members that can speak on her behalf. And that's the whole point of advocacy, right?
That's right.
So the more we train, or the more information we get as caregivers, we just we have the privilege of adding an extra voice or a louder voice with the patient. And together as a family, as we grow and pull together, I mean, this is just vital. I mean, it's just super important. So I really appreciate what you do, Jim.
Well, Rod, I'm sorry to hear that you're going through a hospice experience right now. November and December of 2022, I went through that with my father-in-law, who was dying of pancreatic cancer. And it was an incredibly steep learning curve.
Yeah.
In addition to that, the resources that on paper are supposed to be present weren't.
Yeah.
There's a shortage of home health aides and nursing in general. And so we ended up doing a lot on our own. It was scary. It was frustrating, ultimately exhausting. He's since passed, but our caregiving role, myself and my wife, continue with my wife's mother.
Exactly.
once you get into the role of caregiving, it's very hard to get your pre-caregiver life back.
Yes.
So we try to create strategic partnerships with organizations that really specialize in understanding things like hospice or the legal rights of disabled people, cancer patients, for instance, so that if someone comes to us and says, I'm stuck, I don't know where to turn, we can either do some research for them, or we can point them to our strategic partners who are experts in the field, because it's so easy to get stuck in healthcare in the US. Getting unstuck is tricky, but that's what our concierge helpline is all about. People can reach out to us with any kind of obstacle that they're facing, or questions, they're looking for advice, whatever it might be. And we'll either find a resource for them or send them to an expert who can help them through. And that's a collaborative and cooperative experience. We all have to work together to share what we learn as we go, because there's so much to learn and so many obstacles to overcome.
Exactly. Very sorry for your loss. I mean, that's
Thank
tough. We had a little scare over Christmas too with my dad. He's still there. He's still pushing. But you know, with your organizations, Patients Rising, and with us, with the waiting room, I mean, that's the whole point. Us talking right now, we're just building a stronger network, like you said, and creating this resource for patients and caregivers, regardless of illness or what their needs per se is. And you know, there's strength in numbers, you know, and
Yes.
the more people see this show and learn about you and learn about us, you know, I can't even, like Demi, when she first brought this idea to me, I was blown away. I was jumping in my seat. I couldn't sit still because it's so needed, you know. So again, thanks again for what you're doing. It's very exciting to know your mission. So coming down the pipe, you did share that you have a new curriculum, and you shared a little bit about that. Is there anything else coming down brand new for Patients Rising?
Well, we have a very ambitious project that we're working on. Through the process of like our legislative advocacy masterclass, which teaches people legislative advocacy skills, we've realized that patients and caregivers need to refine their voice for telling their story and for demanding the change that they need. For instance, if you're just coming through a really frustrating diagnosis or period in the hospital, or you've just lost a loved one, you're in a very emotional state.
Yeah.
That's not the best state to go seeking solutions to problems, because that's where communication doesn't work very well. So we want to build something like a speakers bureau. We don't know what we're going to call it just yet, but the idea is to train people in the two different kinds of expression that are important to patients and caregivers. One, the therapeutic expression that helps you as an individual get over the trauma of living with a disease or experiencing a loss. But the other type of communication is strategic storytelling, the kinds of things that can influence a legislator to take your concerns seriously, or the kinds of skills you can use when presenting in a conference, right? Many years ago, I'm not going to say exactly how many, something like 20, I was, I found myself the day before a big patient conference. The doctor who I worked for had to pull out, he got sick. So I had to step in and be the keynote speaker at a big patient conference with less than 24 hours to prepare. Well, I bombed, okay, because I didn't have time to prepare. And I don't want other people to bomb when they have to stand up and either make that elevator pitch or get an opportunity to really change the way people think about disability or a certain diagnosis. You got to be ready for these opportunities. And so that's a big goal of this speaker refinement and education that we plan on putting together, getting people ready so that when they get on the elevator and Joe Biden happens to be standing there, you can make the most of the 60 seconds that you've got, you know.
Exactly. Yeah.
Now- Oh, go ahead.
I'm sorry. I was just going to say, I'm such a big believer with the storytelling because it makes it personal, and it's not all of a sudden it's not a pitch. It becomes a conversation, right? And that's what we need. We need clear conversations.
Yeah. When we talk to a legislator, we need to remember that we're not talking to a Republican or a Democrat. We're talking to another human being who has probably experienced some things a lot like what we've experienced or are experiencing. So we have to remember to make that human connection, but yet also we have to remember to make a good, sound argument for what it is we need. And we need to make sure that we come across as credible because, well, thanks to social media, there are a lot of wild ideas out there, and not all of them get transmitted effectively across the social circles. So we have to get better at communicating with each other, respecting each other, and having a compassionate tone, whoever we're talking to, because we're all really in this together. And if every single person you've ever known is a patient at some point or another, you know.
And Jim, you mentioned legislators. Are you guys going to go to DC again this year?
There's a plan to do that in June again. We don't have any solid dates yet, but the first fly-in to DC that we did in June of 2022 was such a big success. We're talking about almost, I think it was 60 meetings on the nose with different congressional representatives, led by patients. You yourself were there, Debbie, you remember. The people were speaking to their representatives, making it clear what the people's priorities are, what patients and caregivers' priorities are. And I think it was a very empowering experience. And we got some things accomplished too. It wasn't just a feel-good mission. It actually resulted in some legislation getting passed. I'm not the expert on that, so I won't talk about it, but you can talk to Rachel, the executive director of Patients Rising Now, for more information on that. But yes, we hope to do, no, it's beyond hope. We're doing another fly-in this year. We just have to figure out all the nooks and crannies to get there. But yeah, probably in June, we'll be traveling to DC again with a new slate of initiatives to make really clear to our legislators.
So so how does patients sign up for this? Do they, once they complete the advocacy class, then they're eligible to participate in the fly-in, or how does?
Well, something like that. When we're looking for people who have the skills to be effective speakers at a fly-in or a Hill Day, one of the things we want to know is, do they have the advocacy background that's needed to have the desired impact? So the first time we did this, yes, we looked almost exclusively at people who have gone through our legislative advocacy masterclass. But in a perfect world, we'd open that up because, of course, we know that there are many super qualified advocates that we just don't know yet, who maybe don't have to go through a masterclass because they already have tons of experience in legislative advocacy. So we do want to open the doors to a more diverse representation of patients across the country. But if we ever have trouble finding people, we know we've got our masterclass graduates and our delegate program that we can lean into, because these people are already seasoned and proven interested in this kind of work.
And what is the delegate program?
Oh yeah. So the delegate program is kind of like this cool club for people who've graduated the masterclass, right? I say club because there's not a hard agenda for like accomplishing X, Y, and Z every month. It's really a great place, however, for people who are really dedicating their lives to advocacy to network with one another. Our delegate program represents, I think at last count, 16 different primary diagnoses. So we've got people from all different kinds of disease communities who are coming together and talking about what they're advocating for. And when you have a group of people having a productive conversation like that, you realize that there are a lot more things in common than different as far as going to the Hill and trying to make change. So we think it's a really great opportunity for networking. We have monthly meetings where we get updates from our experts at Patients Rising Now on things like, you know, legislative updates. What are those bills that we were talking about at the FlyIn? Have they made progress? So it's a good way to keep in the loop and get to know other advocates. And we think that's really important because you can save yourself a lot of frustration if you borrow what someone else has already done well. You don't have to reinvent the wheel every time you have a problem to solve, you know?
Yeah, that's great. I really loved the program. I enjoyed it a lot. I actually realized I wasn't so much of an advocate as I thought I was. And when I got there, because you guys just shared so much more information than I ever thought I could even comprehend. And then you made that really cool dictionary. So that we could understand the other language, because it's like speaking a whole nother language.
You're absolutely right. When you get into things like legislative advocacy, if you don't know how to talk to a congressional representative, then you're talking here, they're listening here, the connections aren't being made. We have to learn how to talk to each other. And that involves language and compassion and understanding. So yeah, having a little thing like the glossary of terms for legislative advocacy, it's just one of many things that we try to do to level the playing field and make our advocates as effective as possible. But there's lots to learn, to be sure.
Yeah. So do you happen to know when the next class is going to be?
Yeah, our next semester of the masterclass is planned for the very beginning of March. Okay. We might be able to move that up into like the third week of February, but I think you can feel pretty confident that early March is when the next one will start. And then we're going to try to do it every quarter. So we're getting a little bit of a late start out of the gate, but that's okay, because we have to figure these things out so that the student's experience is a good one. We don't want to rush just for the sake of filling our ideas of how often we should do this. So even if it's only 3 times this year, but done well, it'll definitely be worth it. And then for sure, by next year, we'll be doing 4 every year. So look for March.
Is there a charge for the class?
No, totally free. I think we all pay enough into the healthcare system just to try to survive. We offer this completely free. And we're able to do that because we have good relationships with sponsors who also see the value of empowering patients to make the changes that they need. So it's a big collaborative effort. And I'm really proud of the work we do and the sponsors who support us and the patients who talk us up. All of our recruitment happens person to person for the most part. After graduating the first class, pretty much everyone who's come ever since then has just been referred by somebody who's graduated the class. So yeah, we take that as a high compliment.
Yeah, so Demi and I already know, but for our followers and listeners that don't, can you speak just briefly real quick about the instructors, their background, and you know, what they bring, because they bring in so much value. These are folks that are 100% legit. You want to learn from these folks. So can you speak on about them for a little bit?
Sure, yeah. When we went looking for experts to talk on the different topics, both for the legislative masterclass and for the self-advocacy class, we interviewed a lot of people based on what their real world experiences were. We didn't go into academia and look for the smartest PhD to talk about, not that there's anything wrong with that, but that's not what we were trying to do. We were trying to get people who have already been through these challenges and learned the hard way how to overcome them to be the instructors for the next generation of advocates. So we brought in Brooke from IBD Moms, an amazing teacher. Tamika Felder to talk about storytelling, an incredible storyteller herself. Jen McNary to talk about drug utilization review boards and the FDA. We're also bringing in new instructors with the self-advocacy class like Richie Kahn, who's talking about patient-focused drug development and how that impacts you on the ground as a patient. I can't remember everyone because it's like looking at the roster of an all-star team. These are names that you've probably heard if you're involved in advocacy already or education in healthcare. We wanted to bring credibility. And so that was our highest standard, credible people with real world experience. So I think you're in for a treat, anybody who signs up for these classes, because you're getting the real deal from the mouths and minds of people who've been through it.
Yeah. And you also talked about sponsorship. How can someone help out if they want to be a sponsor or donate?
Well, we have a couple of different ways to do this. More recently, we're trying to rely on contributions from the community. Since, to use the term stakeholders that I referred to before, this is where the term stakeholders actually fits. We're all kind of in this together. So we want to make sure that the patient always has the loudest voice in everything that we do. That also includes giving them the opportunity to raise money for us if they believe in our mission. And I'm very proud to say that several patients started their own fundraisers to raise money for us and did rather well. All that money doesn't go to overhead costs or anything, goes directly into the programs that are helping patients across the country. So there's that person-to-person fundraising opportunity. But there's also corporate sponsorships. We have great relationships with companies like Jensen, Baxter, BMS. There's a lot. They probably wouldn't want to be mentioned all here anyways. But the point is, we go to them and we say, we have observed and patients have told us that this is a hole in the public understanding of this disease or this policy issue, like pharmacy benefit managers, that are really tripping people up. If you can help us financially, we can bring these services and products directly to patients and caregivers. And they've been kind enough to support us and continue to, because they see that really good things come from it. So if you have money and you want to support patient and caregiver development, we promise that we're going to make the most of it. And we're always getting our feedback from the community that we're trying to help. So transparency and honesty are the hallmarks of what we do, but because our patient population keep us very honest.
Yeah, I tested out the Facebook fundraisers. I thought that was a really easy way to do it, and I tested it for my birthday, and we actually exceeded the goal.
Yeah.
So that was pretty neat, and it was very easy to do.
Thank you very much for that, Debbie.
Yeah, it was really easy to do, and I thought that was a good way of people doing it, that they could use it for their birthday fundraiser. But we were so happy to have you here. You got anything else, Rod?
No, I just appreciate seeing you again, Jim. It's been a long time, and hopefully we don't wait as long as like I said. And we have very busy lives. I get it. but I'll definitely be in touch. I've got some, yeah, I've got some stuff that's I wanted to share with you later. So we'll do that. We'll do that offline. So.
Well, the
Yeah,
waiting
and
room is
Jim-
doing great work and helping a lot of people. So keep up the great work, and I'm at your disposal anytime.
Thank
And
you.
Jim, share your website.
Oh, yeah, right. If you want to learn anything about us, come to patientsrising.org. It's a good portal for all of our different programs. You'll be able to learn about the masterclass and different learning opportunities, our education modules, as well as our the patient helpline, which is growing in popularity all the time. It's where our blog is. You can just see all the many things that we're doing there. Our partners and sponsors, come by and visit. And you can always reach out to me. You can catch me on our Instagram, Patients Rising on Instagram, or Facebook. We're Patients Rising pretty much everywhere. And you can always reach me by email, jsliney@patientsrising.org. No question too big or small. Okay,
Yeah, and we also got the Patients Rising Facebook group.
that's right.
Yeah.
Which is growing by leaps and bounds, thanks to the help of some very generous people, Demi.
But we want to thank you for being here so much. All Jim's information and all the information on Patients Rising will be listed in the description below. If you would like to speak with Jim or any of his coworkers, just reach out to him using the links that are in the description. If you need to reach us here at the waiting room, you can always reach us at thewaitingroom@gmail.com. So I want to thank you guys all for being here today. And Rod, you want to say anything to say goodbye to everybody?
Oh, that's it. I mean, it's always a great privilege and pleasure to do this. Thanks again, Jim, for being here, and we'll see you all again real soon.
Bye, everyone.
Bye.